Okay, good afternoon, everybody. I think it is a great opportunity for all of us to participate in this webinar organized by Blockchain for Europe. It is a very important discussion because, as you know, during the pandemic, this is something new, digital acceleration. And we are considering what kind of digital issues, digital solutions, digital tools we can use also fighting against coronavirus. From the mid of April, it was a big debate how to use tracing apps to know more about trajectories of this disease, to know more about contacts between people infected by coronavirus and their environment. This discussion was led by the European Commission, and we have European guidelines. All member states agreed that it is important to have some principles. Those principles are related to privacy and security protection, voluntary participation in using those apps, and also last days on 16th of June, it was an agreement done by the member states on how to use and how to set some technical specifications to use tracing apps for in interoperable way, which means to use when we are traveling across internal EU borders. It is a crucial solution, but on the other hand, we see now that, for example, in Germany, there are many users, over 12 million people decided to use these apps. But in France, it is a collapse because many people are not ready to use. 68% persons decided to declare that they are touched by coronavirus with positive results of the test. So there are some question marks, but on the other hand, when we have discussed about these tracing apps, it was clear that we need to take into consideration encryption and full security, that we need to focus on decentralized model, so not to be open for this kind of French solution, which means gathering the data in the big state collection. Also, it was a discussion on using specific tools as it was suggested by Apple and Google. But when we are analyzing all of those requirements, it's clear that there are some functionalities which are important for the blockchain. So today's discussion should be focused on the question if using tracing apps, which is needed for exiting from the lockdown and probably will be very needed in the second wave of the coronavirus, and how we can use blockchain solutions. We have a very great and fantastic group of panelists invited for the discussion. Our plan is, I will give the floor to our panelists. After that, I hope we will have some interactions between panelists, and after that, I hope we will have time for some questions. There are some possibilities to put the questions via chat, and at the end, we will have some 2 minutes for every panelist for final comments. We have today Sirpa Pietikäinen, member of the European Parliament from Finland, EPP group, and I hope that the connection will be good. We will have Christian Dunia, the policy officer, cybersecurity and digital privacy policy unit at European Commission, involved in the work and the preparation of this common EU toolbox for member states, which means mobile applications to support contact tracing in the European Union with some principles as voluntary use, approved by national health authorities, privacy preserving, and dismantle as soon as no longer needed. We will have Eliott, Teissonniere, blockchain architect from Nodle. In 2020, he co-founded a coalition network, a non-profit foundation that provides an open source, secure contact tracing solutions for governments, universities, and organizations to integrate into their health system and protect global citizens during the current coronavirus crisis. And we will have, last but not least, Frank Ricotta. I'm not sure if you will have the connection, but I hope, CEO of BurstIQ, very experienced manager and architect of many blockchain solutions, leading now the healthcare blockchain data company, working on personalization of many products and services. So I think this is a great group of panelists. I want to start with, if you agree, with Christian Dunia, because I think it would be very important to know what is the view of the Commission, not only of those tracing apps and the usefulness of this and the very need how to use it, but on the other hand, how we can use also different kind and various technologies. If I can ask you, Christian, please, let's start.
Well, thank you, Michal, and thank you for the invitation to be with you. It's a very interesting discussion. I'm going to talk briefly about what we've been doing in the Commission with the member states in this area, give you an update on where we are. It's a picture which is changing, almost every day in terms of the member states who have decided to launch an app or who have changed their minds about what sort of app they want, etc. Secondly, I'll offer some reflections on the key questions of privacy and trust and the use of technology, digital technology in this area of public health. And thirdly, I'll touch on what could be the relevance of the blockchain. So where are we at the moment? We started this exercise in late March, early April, when there were lots of discussions around what role technology and data could play in combating this this extraordinary threat of the pandemic. And we were also thinking about how to exit from the pandemic as quickly as possible. Fairly quickly, a consensus arose that the use of a mobile app to detect proximity and therefore support contact tracing was a very promising area. So if you think the three key things to do when you're combating a highly infectious disease like COVID-19 is testing, tracing, and isolation. This technology promised a lot, and we saw the first deployment of an app which relied on Bluetooth technology, which seemed to minimize the impact on privacy in Singapore. So we acted very quickly in the Commission. We adopted a Commission recommendation which set out a roadmap of what we wanted to do. And then a week later, on the 15th of April, the member states represented in the eHealth network published a common toolbox for the use of these apps. And what this toolbox did was set out a number of parameters which would be acceptable for the use of this experimental technology. And I emphasize that it is experimental. We've not used it before, certainly not in Europe, and we didn't know, and we still don't know if it's going to be effective. But the parameters included that the apps had to be approved. Back at the beginning of April, which seems like a century ago now, there were apps appearing in Google Play and in the App Store which seemed to be purely commercial ventures. And we wanted to make sure that the apps were going to be integrated within the wider program of combating the pandemic within the different jurisdictions of the member states. So it needed to be officially approved. Secondly, it needed to be voluntary because, again, we didn't know if it was going to work, and we wanted to give people the choice whether to use it or not. Thirdly, it needed to be compliant with applicable laws, and in particular, it needed to be respectful of fundamental rights in the EU, the Charter, and most obviously, it needed to respect rules on data protection and on privacy. But then the fourth area was also that we wanted to avoid these apps resulting in stigmatization of people who have been infected with the virus or who have been exposed to people who are infected. And so there's an explicit obligation there that the member states created for themselves to prevent stigmatization, and also to prevent making digital exclusion worse than it already is. The fact that the access to technologies, to smart devices is not equally distributed across the population. There are some parts of the society, older people, for example, who do not have smartphones, or they don't use them, they don't use apps in this way. And then there are others that, for perfectly legitimate reasons, like children, where we wouldn't think that it was appropriate to force a child to use a smartphone. So that's what we said in the Common Toolbox. Where we are now, as Michal has just said, that there's been one of the most recently launched apps in Germany has had remarkable success in terms of downloads. There have been well over 10 million in just over a week. I think it was launched on the 16th of June. In Italy, using a similar architecture to the German one, they've had 3 million, the latest statistics I've seen, 3 million downloads. In France, it's been lower, 1.9 million. Outside Europe, a recent application launched in Japan has had 2.7 million in the first 3 days. So it's mixed. It's not anywhere, in none of these places is it anywhere near the a majority of smartphone users, and it's certainly not a majority of the population. So it's an experiment. Now, what do we mean by privacy and trust in this area? And trust is obviously extremely important. We talk a lot in the Commission about solidarity, about data altruism, and we're thinking that this is probably a unique opportunity to demonstrate that. So we think that at the heart of these apps, if they're going to be successful, is trust that they're approved by public health authorities, and therefore we can trust them with running, not necessarily accessing personal data, but we can certainly trust them with running a piece of technology which potentially could be misused and could have a very damaging effect on privacy and on social relationships. So we're not dealing with a sort of trust-free environment as with certain financial services, for example. There's been a lot of emphasis on privacy, and that is certainly a big factor in all of this, in the question of trust, but it's not the only one, and in some ways it probably isn't the most important one. The most important one is effectiveness, whether or not these apps are actually going to make a difference. Are they going to protect people? Are they going to save lives? Are they going to identify in particular asymptomatic carriers of the virus who wouldn't normally be detected by manual processes? So that's the key question. Also, are these apps going to result in false positives and negatives? which would not be helpful for the general exercise. And finally, does it enhance our trust in democratic institutions? Because if you listen to, Google and Apple have taken a stand on how they consider to be privacy preserving in their APIs, but it's very much premised on the fact that your government shouldn't have any data on you. And in a way, I think we would agree with that, because as an experimental technology, we don't want to create any risks that it would be misused, and we want to minimize the amount of data which is processed. But on the other hand, public health surveillance does require authorities having access to personal data in order to combat a common enemy, a common threat. And so privacy is not simply about hiding data from others and about control over data. One very last thing to say in relation to blockchain, we have had conversations within the Commission and with member states about the potential for blockchain technology to help with these apps. There are about 21 countries in the EU which have launched or are planning to launch an app. As far as I know, none of them have decided that they want to exploit blockchain technology for this. In relation to the interoperability solution, which we published last week, which had been developed by the German team, I think it's in the documentation that they explicitly looked at the potential for blockchain in order to manage the data in a secure way. Their conclusion was that yes, it would be a useful way to store the data, and it would be able to, scalability wouldn't be a problem because we're only keeping the data for 2 weeks. But it would add an additional layer of complexity that they didn't think was helpful. So I hope that's useful as a general overview of what we're doing at the moment.
Thank you very much, Christian, for the clear message and the description of the work done by the European Commission. I think it is important what you have said about the work on full respect to the fundamental rights and cooperation with representatives of the institutions responsible for the implementation and the functioning of the General Data Protection Regulation. And as you have mentioned, it was an experiment. Yeah? And now we need to observe, to monitor this experiment, because I think that it will be useful also when we will probably, unfortunately, will be much more close to the second wave, if the second wave will exist in the European Union. But on the other hand, you have mentioned the potentiality of the blockchain. I think it is important because we are also starting the debate in the European Union on European health data space. And I think it is also the experiment using this tracing contact apps, how we will be able in the future to create the background for this European health data space. Now I want to move, thank you very much. I think that we will have time at the end to come back to some issue, to some topics and points. Now I want to move to representatives of business. So please, Eliott, this is your turn now. What is your opinion how blockchain could support this kind of solutions, please?
Thank you, Michal. So to start with, I'd like to quickly sum up what we learned by deploying Coalition, by talking to governments like France, by proposing our protocols to be implemented by other governments like Senegal, or simply talking to universities or even companies or cities. Then I'll jump into what we propose as an architecture and the challenge that we have met. So to start with, what we saw is that there's a need for a solution that can be deployed locally in every jurisdiction. We do not expect France and Germany to share a common service. We expect every jurisdiction to host the data themselves to protect their citizens' data, and that's crucial to us. We do not want a company, a third party, to be even able to access that data in some way. The next one is that we would like to bring interoperability between those systems. As Christian, you said, it seems like the European nations have been evolving on that. They've been proposing solutions, and I believe we can, we can bring something to the table. And the next one is privacy. Our first application of Coalition was to push a privacy-first protocol that would use cryptography to protect people's privacy, to make sure that there is no way to link back a given contact, since we talk about contact tracing, or a given location to a given user. And that's very important to us. So what we are gearing towards is a solution that we call a federated network. So federated network simply means that every jurisdiction is able to deploy its own service on its own infrastructure, and then that we have a way to interconnect every services. And ideally, that would be an opt-in, which means that a given country could decide to share some data with another country, but maybe not with another one. We do not consider ourselves as being the right party to enforce those rules or to decide who can share what with whom. So one more thing is that since our webinar is focused on blockchain and COVID-19, we've been thinking of blockchain a lot. I myself have lots of experience in the blockchain space. And what we know for sure is that we do not want to put the data in a blockchain. And in some way that kind of contradicts with what you said, Christian, just before. From what I understood, the data will be on the blockchain in the solution proposed. We are against that because by default, a blockchain is a public network, which means that anybody could access that data. Even if that data is protected in a cryptographic way, it will pose issues on the long term. The second one is that it's simply not GDPR compliant. With GDPR, we are forced to delete the data if the user asks us. On the blockchain, nothing can be deleted. And the other one is still scalability. But that can be probably linked to our protocol. We create cryptographic tokens for every interactions, and we unlink them from the users. Once we have that cryptographic proof that a contact happened, we have no way to link it back to somebody. Unless, obviously, for GDPR compliance purposes, we may be forced to actually link that back to the user's identity, which, in our position poses a challenge because, in our point of view, it basically decreases the privacy of our protocol to be GDPR compliant, which is pretty interesting. But still, it will be one token for one interaction. And as humans, we may have many interactions with many people. And even if we say one interaction is 5 minutes of contacts, it can be one token every 5 minutes, which for millions of people will be millions of tokens every day to be put on a blockchain. And we know, and we have many examples all over the world, all over the ecosystem, that blockchains are not adapted to that kind of scale. It simply doesn't work. We had many issues with small apps letting people collect digital cards that would simply take a network down. So based on that, here is what we propose. What we propose is to have that federated data management solution to be put off the chain. We do not want the data to be on the chain. The chain should merely be here to control permissions, to issue certificates or proof that somebody is COVID-19, was infected or not infected by the COVID-19 in an anonymous way. And then we can use a chain to then use for certificates through given rules to decide who can access the data and when or in which way. Yeah, that's it.
Thank you very much. I think it is also a very important message you have mentioned, and you have used the expression who share what with whom. And I think this is the principle, yes, because it means that we are active users of this. On the other hand, you have expressed very strongly how important is cryptographic proof. And on the other hand, federated networks, we are discussing not only about these tracing contact apps, but we are discussing about future exchange of data using the various technologies, also blockchain, the expression and the possibility to create this federated network is one of the key issues. So thanks a lot. It shows that we are not only discussing about this concrete experimental solutions, but we are going forward, thinking about future, how to use many technologies to take data, to share data in the secure, in the best and secure way. Now I want to thank you very much, and now I want to move to Frank. I hope that we have connection with Frank Ricotta, CEO of BurstIQ. Frank, could you?
Hi, how are you? Nice to see you again.
Yeah, great, fantastic.
Okay, so hello everybody. I'm Frank Ricotta. I'm the CEO and co-founder of BurstIQ. Agree with a lot of what the previous panel members have articulated. So I'm going to try to build on those comments. I think when you take a step back and look at what's emerged from the broader issues with the pandemic, with not only with the public health side of life, but what has emerged from a privacy perspective, and really the whole purpose of what we're talking about today is how you balance that. One central thing has really emerged, and that is really how do we handle an individual's identity across the spectrum, and particularly a digital identity. I mean, the industry itself was grappling with this approach in terms of how best to really move in that direction. And there are a lot of advocates, and I'm one, that blockchain is a great foundation to build upon from a digital identity perspective. But we have to answer a lot of questions that I think are central to the privacy side of life, like who controls the identity, how narrow, comprehensive is the information contained within it, what form does it come in, what can it be used for, and how secure is that information? All these kind of wrap around this notion. So when we're looking at life from a BurstIQ perspective, we like to say is we build health profiles for people, places, and things, or immutable health profiles. And I would agree that core digital ledger technology is not a place to put sensitive information, but a great place to deal with permissioning and consent recording and all that. But I also think you can use blockchain methods to deal with identity attestations. In this case, there are elements of COVID identity attestations that could be part of a person's identity. And what I mean by using blockchain methods is using some of the consensus methods to digitally sign data objects and elements in terms of origination, validation of those objects, and embedded permission within the data structure. So very complementary. In a blockchain speak, it's digital ledgers with a bunch of interconnected side chains, and there's ways to handle all the GDPR issues in that way and really extend trust, because at the end of the day, there's this foundation of trust. And what we see now as this all is bleeding over, it's not just a health issue anymore. It's not just a public health issue and how we keep people safe, from a virus or a digital pandemic, and how we keep it from spreading. It's also bled over into so many other aspects and so many other industries. The travel industry being first and foremost, where you see some airlines beginning to try to implement tests before boarding, and really trying to extend beyond just temperature checks, as well as, again, the notion of jurisdictional contact tracing. And some have chosen to still rely on manual contact tracing. And then on the converse, you have big tech saying, hey, we can do all this kind of transparent. But then the question is, do you want big tech really knowing where everybody is all the time? Even though when you looked at some of the Google reports, there were that they pulled from a lot of Android phones, they have a lot of data on tracking where people are and their patterns. So I think and then there's one more layer that I think we need to talk about, and this goes into the broader analytics. Is we started an initiative called Research Foundry, really more as a public service initiative to let researchers share information and collaborate around different aspects of COVID-19. What we found is that, well, a lot of the anonymized data gives you really high-level statistics. You know, the underlying data isn't very accessible, which we all know because there's privacy implications with that. But there are key missing elements to support researchers in developing solutions to support public health officials in determining how they confine outbreaks and spread and implement public policies. And so we've seen a number of efforts emerge for data calls in a true collaborative but privacy protected space where organizations, public health, and researchers can share information cross-jurisdictional without crossing some of those boundaries. But it'd be really nice for people to opt in to some of that as well. So again, I think it's multiple levels. It's really the COVID-19 issues and how we deal with this notion of health passports and health status, to broader digital identity, to feeding up the appropriate amount of data in a proper way to facilitate research and collaboration to coordinate responses at multiple levels.
Thank you very much, Frank. I think that as you have mentioned, the question of the problem of digital identity is crucial, yes? Because if in the future we want to discuss about sharing the data and also managing our consents, if the data will go to some platforms, somebody or something should manage consents, where all the consents will go during the time. Yes, so I think it's a new challenge, not only from technological point of view. It's a new challenge when we are thinking about those new solutions, and I think that we are a step ahead when we are discussing this issue. Thank you very much for your contribution and emphasizing these research issues. Yes, please.
Yeah, and I'll add one more thing, since one of the poll questions is around artificial intelligence. You know, besides AI really learning about the data sets, and what we see is really the beginning of a manifestation of ambient technologies, or the whole concept of ambient twin or digital twin, and all those issues around, you know, my presence in cyberspace and how that's owned and how that's transaction. At some point in time, that's where all this path leads us, is to how we provide equitable access to the digital space, as well as how do we manage, you know, our broader digital presence in a way that our digital presence becomes more and more intelligent and even capable of acting on its own.
Yeah. Thank you very much. So we have had a presentation and the view done by representative of the European Commission, two representatives of business with open mind and some practical issues and thoughts. And now I think we can move to the European Parliament, to Sirpa Pietikainen, and I ask you for your comment, because at the end in the European Union, finally, we will come back probably to the European Parliament with those kind of discussions. So please, let's move to Sirpa now.
Thank you so much, and thank you for organizing this team discussion, because I think that there's a lot what we need to understand and try to build a consensus what is the direction where we want to go. And it is very easy in my role to build on the construction what the earlier speakers have made. So I do not need to remind us about the technical neutrality. I do not need to remind about the safety and the data protection and the protection of privacy and all these important things. So on my term, I would like to concentrate in a couple of questions or issues on looking even a bit further. And that is the question: how do we use and benefit the new technologies and what are the best technologies for which purposes to improve the safety and human health. And on that, it actually connects pretty well on this kind of a European patients database or medical registry or whatever that is, because that needs to exist. So that while I'm in Romania or in Paris, if I need some medical care, someone would in urgency, or provided that I give the permission with my PIN code, an European health security card, it would be known with whom I met, where I was, what are my diseases, what are my genuine, and what are the medication that I'm having right now. And I think that this is the longer path. And while we are sort of thinking these kind of a COVID apps, we shouldn't be only thinking a once in a lifetime system, but try to build it on that kind of a grounds where we can then go further for that kind of course, secure, but that kind of a road where the information with the person would be portable and always, be it PIN code or whatever is the fashion. And this is actually the question for my the other participants. How do we secure that fact that you can always have the decision to whether to share that information or not? Because sometimes I would like to share it, sometimes I might not. And then I could give that kind of a permission that in emergency cases, anyway, this information is available. And then actually I would go even broader, and that actually gets with these very sensitive issues we heard in the last intervention. What about if they know that I have 3 cats, that to which gym I go or I don't go? What about that if the databases connects that with my shopping lists and my behavioral choices? What about if it knows about my sexual preferences? This data, if it can be scrambled adequately, would be very excellent basis with the AI to be used to develop and understand better the human health and the complex interactions. But then again, as you said, huge risk, horrible thing that someone would know where I have been and with whom I slept last night, and whether my cats are out or in, or whether I eat my sausages or my broccoli, and so on. So how to combine these two the two aspects: to collect the information anonymously, and then to always have the safeguard not to reveal, be it COVID or be it health or be it other issues, without my consent. Without my consent, in be it research or other possibilities. And then again, the one issue there is, and in that case, the COVID is a special case. Can we create that kind of a platform that is ready-made with WHO for pandemics? Because I bet this is not going to be the last one that we are going to see. So how actually we can trace it globally, then when it moves from Europe to China, from China to Europe, and sort of try to help to identify and stop early on, and maybe with this kind of a genuine information in the longer run, to understand why male or female or this or that type of the people are more in danger for this kind of infections. And I think that we need this. And I'm very personally very supportive, and I'm very bold and brave on this e-health and using digitalization and blockchain, because I think that the blockchains have pretty good merits, as we have heard, when it comes to the using a huge masses of information and handling with the security issues. But then again, I would leave you with the question: is the blockchain the solution here? Or do we have other technologies or systems that might be better used to use it right now and then on the future for this kind of medical and other information to serve for the individual, him and herself, and for the greater good for people's health. And this is pretty general comment because I do not have the expertise in details, and this is exactly why I'm so excited of having this opportunity for discussion, how these issues should be solved or how and where we should be investing. But I'm quite committed that and convinced that we as a European Parliament should form some sort of an understanding, broad lines, what is acceptable and desirable path, and push that forward to happen in the European level. Because if we leave it only on member states, we are going to have the whole rainbow of different kind of initiatives and alternatives, and of course markets probably are going to produce something, but we do not get the same effectiveness compared if we have this kind of even upgraded joint effort. Thank you very much. And thank you, Michel, very nice to see you. I really enjoyed working with you.
Thank you very much. It's a pleasure to hear you, and I hope that after coronavirus we will have a meeting in Brussels in the Parliament. Additionally, I want to say to all participants in our webinar that there is a poll in progress. So there are some questions, and you can answer for those questions. And we are very interested in your opinions because it will be very important for us to know what kind of directions you can choose. There are questions addressed to how do you feel about the use of emergent technologies like artificial intelligence or blockchains in the healthcare industry? Is full medical data privacy still wanted in the context of global pandemic? A little controversial. Why are current approaches failing to achieve wide uptake? Multiple choices. And the fourth question, who should be involved in the development of this technology to ensure uptake? So I hope that you can vote. Me and panelists, we have not possibility to vote, but I hope that you will vote, and at the end of the meeting we will know more about this. Sirpa, some questions addressed to all panelists, especially to Eliott and Frank, about the possibility, future possibility and potential of blockchain. Could you answer what kind of step, the next step we can do? Because very often during conferences, also we are discussing about using blockchain in healthcare systems, but it is addressed to the local solutions, regional solutions. It's very high when it is addressed to national. But now we are talking about something more, European Union. And of course, during pandemic, it could be great to have this kind of platform and possibility to exchange the data also for analytical efforts at the global level. So what is your opinion about blockchain possibilities? Frank, could you share with us your opinion?
Sure. Well, you know, I'm a big advocate of blockchain, but you know, the way I look at blockchain is really as much of a way of doing things as it is a piece of technology in terms of how it's applied and where it's used. And I think it solves a lot of problems from the standpoint of creating a solution that has an inherent trust component to it, with the ability to extend and support both personal privacy as well as the needs to share broader information. So I think, you know, a good first step is really, I mean, I'll go back to the identity space, is in how say from a European perspective, that we can leverage it from a digital identity perspective and extend some of those distributed identity concepts to include these notion of health passes or health status in a way that supports both public health and some of the other industries. I personally think that's the first large-scale adoption of the technology. On the banking side, it's been really pushed in the Know Your Customer and anti-money laundering solutions. But again, health is really about collecting the data about oneself in a way that you can still keep a whole lot of it private, but be able to represent the kind of things you need for society protection.
Yeah. Thank you. Thank you, Frank. And Eliott, what is your opinion? What is your view?
I mean, first I would call for digitalization of what we do currently in the healthcare system. When I go to the doctor, I have to give him a little book where the doctor is going to write a few things, with his hands, or probably print something. Then if I go to another doctor, I have to show him that little book. I have to get some printed records of what is my health file, what is, am I sick, what is my condition. And besides using blockchain or not using blockchain, it is crucial for the improvement of our health system to digitalize it, to make it more efficient and to support an easier way to share data between health entities. Yet, by using blockchain, it seems like the most adaptive technology as of today to support a better control of the data. I want to be in control of my data. I want to be able to say, well, you doctor, whatever is his name, can access my data, but you doctor, whatever is your name too, you cannot access my data because I'm not working with you. You are not my doctor. And to me, as a personal potential patient, I can get sick. That's crucial, and I believe that's also crucial for most citizens. They want to be in control of their data. Back in the times we had all those huge financial systems, and people will be able to, any employee basically will be able to connect and see all your financial data, which is probably a very bad idea in terms of health and even finances. So what I'm calling for is, let's use what's around there to be more efficient and to support better privacy or better controls. And maybe it's blockchain, maybe it's not blockchain. What I find very interesting about ecosystem is that people, yes, care about blockchain, but for them, it's not a finality. It's merely a solution to an end, which is to get more control, to support more complex systems. And maybe the solution is just to use advanced cryptographic solutions, or maybe not. So yes, blockchain, but whatever, maybe it's not going to be a blockchain. Maybe it's going to be, I don't know, a set of servers talking to each other, and it won't be the same protocol. It's fine. What we want is really to improve the status quo.
Yeah, thank you. Thank you very much. On the one hand, we know what is important, cryptography, full security, respect for the privacy, but you have expressed very strongly data control possibilities. It's very important because very often we are using consent only in this mode as I'm clicking yes or not, I agree or not. When we are talking about managing the data, my own data, so I think it is very important to have much more complicated tools, because probably when we are talking about digital health data, it would be great to have the possibility for me as patients to follow my data, to know what is going on with the data. Yes, so it means active to be active patient. Yes, to cooperate with my physician and to know how data is analyzed also for my benefits as the patients for future therapy and so on and so on. So this is much more practical involvement of all patients, yes, and I think it's also very important for the future. Now I think we have the possibility. Thank you, Eliott. Now I think that we have possibility to look at the results of those polls. I hope that our participants decided to participate in this poll. Robert, could you present the results?
Yes, thanks, Michal. Happy to do that. So thanks for the participation. The idea is, to use the results that we generate out of this to test it with our panel, if they're surprised about it, if they think this is actually what they expected, or if this is something that they weren't really aware of or were not so expecting as an outcome. So the first question was, how do you feel about the use of emerging technologies like AI or blockchain in the healthcare industries? And as options you had, I don't understand it, I fully support it, legal clarity is still needed. And over 60% think that legal clarity is still needed, which is something probably addressed to the Commission, as they're in charge of coming up with legal certainty, among others. And the second question we asked was, is full medical data privacy still wanted in the context of a global pandemic? And the majority said, yes, trust is paramount. Only 8% said, no, it's a barrier to an efficient response. And 38%, so nearly 40%, there's a need for a balance between safeguarding privacy and public health concerns. So there's, as you can see, still a demand here. Why are current approaches failing to achieve wide uptakes? And that there was the opportunity to make multiple choice answers, and the ones that basically won the race were lack of awareness and understanding on the first side, and a fragmented approach across the EU and lack of interoperability. Nobody believes that the timing was an issue, so the lack of time to implement this. Others, and this is around 30%, think privacy concerns are the key issue. And the last question we ask is, who should be involved in the development of this technology to ensure an uptake? And again, you had the choice between multiple questions or multiple answers. And by far, the answer with the biggest response, 70%, multi-stakeholder involvement is needed. Second one was the public sector is responsible, 38%. Civil society should drive it, 31%. The research community should drive it, 31%, and 15% think that there's no need for a COVID tracing app. So maybe back to the panel, and I think there's no order in this regard. Is this something, I mean, you heard the answers, is any of this surprising to you, or is this basically what you expected, or is there, and where do you think is the need, or where you can step in as an either business or a policymaker? Thank you.
Yeah. Thank you very much, Robert, for the presentation, and thank you to all our participants for their contribution in this poll. And I think that at the end of our webinar, I think we want to have some comments done by our panelists. And now I want to start with Sirpa Pietikäinen, member of the European Parliament. What is your final comment, and what is your view on those polls results? Legal clarity and certainty, trust as a paramount issue, joint view and relation and full respect for privacy when we are talking about public health, and many issues which are important for finding the solution if we want to use health data. We also have two questions from the audience. Robert, could you read those questions, please?
I actually think that as we have a tool to raise your hand, so please again raise your hands. Okay. I know that there were two people. I don't know if they're still on there. Maybe if you want to step up again, please do again, because they were removed. Otherwise, we go back to the panelists. Okay, so maybe they were clarified already in the process, because they weren't.
Okay. So if you will have some signals, we will come back to the audience. Thanks. Now we will start with panelist Sirpa, please. The floor is yours.
Thank you. Actually, the results are not very surprising to me. And I can underline many points there, but I'll just pick up the legal certainty. And I hope that we politicians won't make it too complicated. I remember that when we have had the debates in the parliament about immaterial rights, copyrights and others, sometimes we tend to think that the virtual world, the digital world, is like another planet where the laws of physics doesn't apply. And I tend to think it very simply. While serving in the Econ Committee, I think that if it walks like a bank, if it smells like a bank, and if it acts like a bank, it's a bank. And you should apply the same rules and the same principles that with the banking, whatever you, what is the methodology, and you call it the Bitcoin, or you call it the peer-to-peer lending, or you call it crowdfunding, and you know the story. And then if we start sort of creating a second layer of sort of a logic for virtual world, we are in a big mess. Property rights are property rights in internet and always in physical world. And that goes all the way. So I don't think that we need a separate sort of whatever layer or legislation about virtual world or Bitcoin or something else. We need to just, on my opinion, to adapt and adjust the existing legislation so that it covers the new technologies. You do not, it doesn't matter what kind of a car and what kind of a motor you have. It needs to be secure, and you do not need to ponder about the fact who has the liability. Does the car has a liability if there's the accident, and if it is automated car, or whether the manufacturer or whether the driver has it. It goes just like in normal world. If there's the failure in technology or program, it is the producer and the seller and so on. And how this applies actually to this health issue, I like very much this sort of the ownership of the data. I own the data, what I am, and I decide who gets it and how it gets. Plus then there are exemptions, and this is actually something we might need to, I don't want to, but we might need to sort of need to revisit, like, you know, quarantine is very heavy tool. There might be cases in severe pandemics where we need for the bigger good to for momentarily to intervene with the privacy and your own right to determine of your goings and your data. But that again is already in the national legislation with the pandemics. There's a heavy tools how you can be forced tested and hospitalized and quarantined and whatever if you have very severe disease. So just these principles should be applied, sort of extended on also on here, and then the privacy principles be it in this sort of a next level, and to make this sort of a very understandable and easy issue that okay, even though you have all your data now, you have it on your table, the receipts and your medical files, and you know whom you met. And even if you put them together, if you can control it, it is the same thing. And you just need to ensure the security layer. And my last thought is for all of you, a bit of a wild card. And while we have already the IBAN in Europe, in banking sector, the identification number, what about if we would have the IHAN number? So this kind of a number or identity recognition system we all would have from birth to on, and it could serve as our phone numbers and whatever. But that actually would be our access and our with the code and this kind of a collecting points of the information, and it would facilitate our lives quite significantly. And we could start with the health, and we should start with the health with the COVID, and then the patient registers and others. And then the big issue, the plea, what I leave you for the technologies, please come to us, come to the parliament, to the parliamentarians, show and explain how you can fight the cyber crime, how you can ensure cybersecurity, how you can make the system as proof and safe as possible. And then again, risk might happen in real world too, not only in the cyber world. So we need to bear that in mind too. So very much thank you for interesting interventions, and I hope I can benefit from your thoughts in the future too. Thank you.
Thank you very much, Sirpa. Robert, we have a question from the audience. Could you read it, because we have no possibility to look at this?
Yes, with pleasure. So we have a question from Geoff Goodall, who's a professor at the UCL, who asks, we know that data protection, which is about preventing unauthorized use of data, is not the same as privacy, which is about not revealing it to the system operators in the first instance. Is it possible to design a system that allows individuals to put the system to effective use while not forcing users to trust any third parties with their data, specifically including metadata or linkage between their records? That's probably a question to both gentlemen from San Francisco and Colorado. So please go ahead, guys. And I think the Commission also has some ideas about that, probably.
Okay, thank you very much. So now we will move to Frank Ricotta, take into consideration the results of the polls, the discussion, and also those questions. This question done from audience. Please, Frank.
Sure. I mean, I think the question strikes at the heart of some of the things we've been talking today. Is how do you build a trust framework that balances what an individual the individual rights and privileges, as well as other aspects of data ownership? Because in the health space, data is not just owned by you as a person. I mean, a lot of regulatory environments require, for instance, doctors to maintain your records for a certain period of time. So where is that trust layer, and who is that trust layer, which is important? And one of the nice things about blockchain frameworks is you can build the inherent trust frameworks within the solution sets. Now, mind you, I'm not saying that technology solves all business or policy problems, but it's a good way, and it's a good layer of really establishing digital trust. And this is where a lot of policymakers have to come in. We have to really look at how our regulatory frameworks kind of overlay on these emergent technologies to usher in what is in essence, again, at the heart of this question is how do you create a health access economy where an individual is connected to their health provider and health network every day and all the time, at the same time, still allowing some of that transparency needed for the health and safety of the broader citizenry.
Thank you. Thank you, Frank, and have a nice day, because you are starting the day in San Francisco. And Eliott, please, your comments.
Michal. Yes. So first, I think there's an interesting distinction in the question, which is data protection versus privacy. And I think both can work together. The principle that we've seen applied the most in that ecosystem regarding privacy is to collect and send only what's relevant. You know, up until now, and probably up until still a few years in the future, we are seeing many apps collecting everything they can. Even if they're in the medical sector, they will not hesitate to collect anything they can on the user and then send it to strange servers somewhere. When it comes to COVID-19 tracing and more specialized application, what we can do and what we have the power to do, because we are pushing new solutions with a privacy-first mindset, is to record in an intelligent way only what's necessary. So for instance, for contact tracing, there are cryptographic protocols that allows to generate a cryptographic proof that two people met. And that's it, that's all we need. And if at some point we need to link that back to user, we could have a system where the user comes reveals his identity in quotes, and suddenly, gets linked back to all the interactions he recorded on the server. But besides that, and to open a bit more the discussion, I'd like to highlight that there are technologies that provide privacy while still providing analysis on top of them. They're still very new, they still seem very fancy, and there's many people that do not understand them still as of today. We call that zero-knowledge proofs, or zero-knowledge cryptography, and homomorphic encryption. So besides whose, under whose strange names that nobody's going to understand, zero-knowledge cryptography simply means doing some complex math operation to generate a result that cannot be decoded. So let's say I want the proof that I've done something. Nobody can take that proof and know exactly what I've done or with whom, yet they will be able to do computation and statistics on top of that. That works very well with numbers. I'm not saying it's going to work for COVID-19. I'm speaking in more general point of view. And homomorphic encryption is really the same, actually. It's giving some data to some server that then do some computation without ever accessing the data, that then returns the results, and I and only myself can decode the result and be like, oh, well, here is the result, and I know it worked. And I believe that in the future, a few years ahead, probably not this year, probably not the next year, we are going to see more of those technologies a bit everywhere. Because they actually reply to that need of privacy while still providing basically data. I want to know how many people are infected and where. I don't care if Michal is infected or if somebody else is infected. I want to know there are 10 people infected in that city, period. And if that person comes to my hospital, then they can probably give me some, their identity again. And then I'll be like, well, you saw 10 persons and they were at 3 locations. I don't know who they are, but that's all I need. And I think that's really the road that we need to take. That's what we need to push. There's still lots of misunderstanding from many people, which is normal, that they think that we need to get more data to provide more statistics. Maybe, we need to know who met who and where, at which location, at which time. I mean, the truth is that if we apply the right solutions, we don't need that to reach the same kind of efficiency. And we really need to look for better protocols and solutions. Because if we start making basically tracking solutions, I mean, contact tracing it's in the name, it's tracking. I personally want to make sure that the solutions we push make the world a better place and that we still want to live in it. That's it.
Thank you very much, Eliott. And now the final word done by the Commission. Christian, the floor is yours, please.
Well, thanks. It's been a fascinating discussion. I'll just add that, as Michal knows, I used to work in, until recently, I was in a data protection authority. I was chief of staff to Wojciech Wiewiórowski and before him, Giovanni Butarelli. So we spent a lot of time thinking through how to encourage sustainable and responsible deployment of technology at the same time as respecting people. Because basically, when we talk about data protection and privacy, we're talking about respecting people at the same time as trying to help them and offer them great services. So the difference between data protection and privacy in EU law is that with data protection, you need to have a legal basis to use data about someone else. That's basically it. You need to have safeguards. You should try to minimize the amount of data you use, but it's not a prohibition on using data. Privacy is a bit different. It's about you having your own personal space respected and not interfered with by particularly the state, but now increasingly big, powerful players like big technology companies. So that's the principle. What I've noticed in this discussion in the last hour and a half is that it's extremely interesting, but I think we've drifted away from contact tracing apps. And I think as Eliott has just said, we're not really talking about contact tracing with the apps themselves. Like it's an app which detects proximity in order to inform an assessment of whether or not someone has been exposed to the virus. So in that sense, it's experimental technology. And if you follow that logic, because it's experimental, we certainly need to minimize the likely consequence for individuals. We also make sure that the technology is fully functioning and works so that people can deploy it quickly and rapidly and assess whether or not it's useful. I think this is the concern that I've heard from developers in member states, and really it's their responsibility to develop these apps, not ours in the Commission. It's that blockchain is interesting, but it would add a level of complexity and synchronization lags which would prevent the speedy deployment of what they're trying to do. Now, they're not excluding using it at all, and I've certainly learned something from Eliott today in relation to the fact that it doesn't necessarily have to be a solution for processing the data. It could simply be a way of supporting certification and proofs. So that's an interesting area to look at. But when we talk about these apps, there is very, very little personal data which is processed with most of the apps that we're talking about in relation to the ones in Germany and Italy and so on. 19 member states have decided to launch an app where they follow the DP3T protocol decentralized solution, where in effect these are encrypted keys which are generated every day. They're ephemeral. There's no way of identifying someone without additional information using those keys, and then the individual chooses whether or not to upload them to a central server, which simply then broadcasts them to other users so that they can see on their device whether or not they match someone that they've been in contact with in the previous 14 days. That's all it does. And so I think we're still trying to see what would be the added value of blockchain technology in this. And so the last thing to say is I was interested in the results of the little survey that you did. Privacy is not a barrier to public health and the use of technology in public health. Data protection authorities across Europe have said that on several occasions. The danger is, with all of this, is that we start to put our trust in technology and not in people who are accountable in democracies for what they do. So public health authorities are public institutions. They're democratically accountable. That's why it's important that they take responsibility for the apps which they launch. What happens if you simply trust the technology is that if there is a problem, if it's hacked, if the software is hacked, if the protocol work, if the network fails, who do you go to? What recourse does a citizen have if something goes wrong? There has to be accountability, and that's why we've emphasized that that for contact tracing apps, proximity detection apps, it has to reside with the competent public authority, which in most cases is the public health authority. Thank you.
Thank you very much, Christian. I think it is also important to understand that we as patients, we are talking about health and public health, we as patients have our rights. And I think what you have mentioned, it is important, yes? We need to, for whom we need to go and what kind of redress mechanisms could function when something wrong is going on. So we need the cooperation with and the responsibility done by public health institutions. Thank you for the very fruitful and very inspiring discussion. We have started from the issue contact tracing apps. We have discussed many dimensions of this solution. Also, we raised the question, what kind of technologies and various technologies could be useful? And we discussed about the blockchain functionalities and the blockchain potential possibilities for the future. I think it's very, very important. And I think that one of the general conclusions from this discussion is that we are going forward. Indeed, we have to go forward. It means that on the one hand, we have coronavirus and we need some instruments, some tools, those apps, contact tracing apps. But on the other hand, we need to consider how in the incoming future, we need to prepare the solutions for this European health data space. And I think that our discussion today was some kind of a pilot discussion, yes? What is important, how to discuss about data control, what does it mean ownership of the data, what does it mean trust, how important are federated networks, how important are cryptographic solutions, how important are solutions related to digital identities, and so on and so on and so on. So I think that due to the blockchain for Europe idea, we have started this discussion today. I think that it would be great to continue this discussion in the perspective of some months, because I think we need to use our experiences from the coronavirus, also from using those tracing apps to think about the future and the new models of European health data space. Thank you again for participation to all of you, to all participants. Thank you very much to Sirpa Pietikainen, to Christian Dunia, to Eliott Teissonniere, to Frank Ricotta, and again, thank you very much to Robert Kopich as an organizer and the good spirit of this initiative. Have a nice afternoon. Thank you. Bye-bye.